This patient has acute myeloid leukemia. I'm guessing he's receiving total body irradiation for a bone marrow transplant. Hi, Mr. Johnson.
Yes.
How are you?
I'm good. How are you?
Okay. Can you actually your therapy appointments right now? So can you just follow me?
Yeah, sure.
Okay. I'm just gonna ask you to stand here. Your legs apart, please.
Okay.
And I'm just gonna put your arms up. Okay. So we're actually gonna begin soon. So can you ask you to just don't move until I get back?
Okay.
Okay.
Have you noticed what the therapist did wrong? Although the patient here should have a total body irradiation for his bone marrow transplant, which means that we're trying to use radiation to cover his whole body to kill all the bone marrow cells. However, the radiation therapist still has to follow the correct standard protection procedures to preserve the patient's fertility and eyesight. Human spermatogenesis is very, very sensitive to radiation, and permanent sterility can be achieved with an acute dose of 5 gray. Even with total body irradiation, which usually utilizes fractionated doses, the temporary sterility can still be achieved at about 0.15 gray. And permanent sterility may still be achieved during the course of the treatment. The human eyes can also be very sensitive to radiation. The threshold for severe cataract formation is about 2 grays in acute radiation dose or about 4 grays in fractionated cumulative dose, which is often used in radiation therapy. Without proper eye shielding, the limit can be easily achieved within a few treatments. When performing a total body irradiation, proper shielding must be used for the patient. For example, for the patient's scrotum, the standard protection procedure is to use the scrotal clamshells. These are made from lead. They're about 1.3 centimeter in thickness. They're used to absorb and attenuate the radiation to the patient's scrotum. And they're composed of 2 cups, and they will be wrapped around the patient's scrotum. And according to some studies, using a single lead shielding can be more effective compared to using the gonadal clamshells. For example, if you're using a 6 MV energy beam, the single lead shield can attenuate about more than 60% of the dose to the patient. For the patient's eyes, the therapist here should apply lead or stainless steel block to block the treatment field for his eyes. These blocks are usually about 3 centimeter in thickness, and they're able to reduce about 60% of the transmission.